that team culture.
Correct. Correct. Let me ask you this, because this kind of relates to it, and we'll wrap up with a couple of last questions. What do you think is the greatest threat to integrated behavioral health right now, or integrated care? Is there anything that your mind really goes to that, it does seem to be picking up steam, more and more people, it's becoming more the norm? What do you see as the greatest threat to this integrated care philosophy or this integrated care movement?
Fortunately, I don't see any big threats, but I think I do see challenges. I see the challenge of kind of maneuvering this new world of telehealth, or newish world of telehealth, and figuring out, because again, the world of telehealth is actually a more productive world for behavioral health to maneuver in. I've known that for years because I did some telehealth in my own past and understood, hey, this has the power of really transforming what we do. However, it really does take away some of those team factors, or makes it harder to manufacture those team factors. So for example, all this stuff we've been talking about, team cultural transformation, right? The stuff that happens when I'm walking down a hallway and I bump into the physician and we laugh about a patient that we just saw. We don't laugh at the patient, but we laugh at maybe something funny one of us said or something. And then that doesn't happen. The creation of culture on a team that is dispersed doesn't happen. And there's a lot of teams out there that are really dispersed right now. And there are teams that are doing a great job, like your team, of kind of maneuvering all of that and being kind of in person and kind of remote. But I think that's a challenge, because I think a lot of places are going to continue on, as they should, I think, with some version of telehealth work. But they really got to pay attention to the human factor of of sustaining teams. I already know that I've talked to primary care providers who are kind of getting burnt down on the whole telehealth thing. It's really hard on them. It's not as easy for them to do their work via telehealth. And it's isolating. And it's taxing in a very different way than being in clinic. So I think those are some elements. And then I think, as always, the larger movements in healthcare are what either will continue to propel or potentially stunt where we go. So the payment structure is a huge one. I think there's probably likely positive things in the future related to that. But if we were to sort of silo off behavioral health payments again and do lots of the same carve-out stuff, if we were to have more and more uninsured folks in our population, if we were to just reinforce the current fee-for-service system, all those things will stand in the way of a team-based approach of any kind, but particularly for behavioral health. Because fundamentally, the issue is this. This is the thing that nobody wants to say out loud. But we cannot sustain ourselves financially. I don't care how much you work at it and try. At most clinics, it's not going to happen unless you're severely grant funded and unless you have some really special payment arrangements. And that's okay.
After we get done, I'll show you some of our budget. You'll be excited. You'll be excited.
Yeah, my old clinic in Wisconsin is doing great too. But the majority of clinics are not. That's the reality. They're not doing well financially, and they're not going to do well financially because it's the numbers just don't work out in a fee-for-service system anyway. So for years, we've been beating the drumbeat of, hey, the truth is primary care doesn't make sense to be paid this way in general. We really need to be included as part of what primary care is as a standard service. And therefore, when we redesign payment for primary care, we should be including integrated care in that redesign. That's really what it comes down to. So those are the things that I think are challenges to what we do and to our system of care and to integrated care specifically. But frankly, I feel very positive about where we are and where we're going. Again, it helps to have the perspective. 2000, 2001, when I first started, There's nothing, David. There's nothing. There's literally, there's one article, I think the Runyon article, the Air Force article that Tina Runyon and colleagues wrote. That was the only article I could find. I did a lit search trying to figure out what this primary care thing was, what this integrated care thing. There was nothing. No books, no literature, maybe a few articles from the 1970s about some random family medicine doc who did this experiment with a therapist in his office. That's it. And then here we are today. You look on our integrated care map, it's littered with dots all across the country. And we're probably only capturing less than 50% of what's actually happening out there on that map. But that's a huge change in just 20 years, you know, so who knows what's going to happen in 20 years? To my knowledge, to my thought thinking, I think in 20 years, it will be unconscionable for an individual to go into a primary care clinic and not be able to see a behavioral health provider. You know, I think access to psychiatry will be that much easier and fluid, both via telehealth and through, you know, collaborative care, model type care workers or care coordinators and care managers, what I'm trying to say. So it'll be the standard of care that at most clinics, you're going to have access to behavioral health support. I feel pretty confident about that.